So it's been known for decades that lead exposure in children has an effect, a negative impact on the ability of children to learn. Many studies have recognized that even at 5 micrograms per deciliter, which is the current level of action, it used to be about 3 or 4 years ago, it used to be 10 micrograms per deciliter. There are now a number of studies that have shown that the impact of exposure even at a lower level or actually produces a greater negative impact on the IQ of children. The key here is primary prevention in not allowing children to be exposed to lead sources from whatever those sources may be, whether it's water or household dust that contains paint, or from toys that might have been painted with lead-containing paint. We need to understand that children are exposed to lead on a regular basis, not only in Detroit, Michigan, but in many places throughout the United States. So this is a situation that has occurred, that is current in the news, but this is a problem that has not gone away. Public health policy that was initiated in the 70s to take the lead out of gasoline and paint has been very effective in reducing the number of children that have been exposed throughout the decades to today. So there's a clear effect, but lead-exposed children continue to occur in many cities and inner cities throughout the United States. There are many parts of the world where lead exposure is an even greater problem. For example, in China and India and parts of South America. And there are actually countries that still continue to use leaded gasoline even today, despite the fact that we know that this is a significant source of lead exposure in the environment, from the environment. There have been recent cases in the last 5 years in Africa where artisanal mining of gold have actually exposed children in these areas to blood lead levels that are unheard of, in the 100 to 200 micrograms per deciliter. And here in Flint, Michigan, we're talking about 5 to 10 micrograms per deciliter. Those levels actually have resulted in seizures and death of many children in this particular situation in Africa. What is currently emerging is that these children that have been exposed to lead in the early ages of their lives, when they grow up, actually there is emerging evidence that they may have a mental disease, such as, for example, anxiety disorders, depression, and even there has been association linkage with schizophrenia.